Ever wondered why diabetes is often referred to as a silent killer? Today, we're peeling back the layers on this prevalent health condition that's impacting millions globally. Despite its vast reach, diabetes often goes unnoticed until it's too late, earning it the moniker of a silent killer. Understanding this condition is crucial, not just for those at risk, but for everyone. In the next few minutes, you will gain a comprehensive understanding of diabetes, its types, symptoms, and treatments. To begin with, what exactly is diabetes? Well, in the simplest terms, it's a chronic disease that affects the way your body turns food into energy. Intriguing, isn't it? Now let's break it down a bit. Every time you eat, your body breaks down the food into glucose, a form of sugar which is then released into your bloodstream. Your pancreas, a small but mighty organ tucked away behind your stomach, gets into action. It produces insulin, a hormone that helps this glucose get into your body's cells to be used as energy. But here's where things get complicated in diabetes. This process doesn't function as it should. In some cases, the pancreas doesn't produce enough insulin, or in some instances, any at all. In others, the body's cells don't respond to insulin as they should, or the body doesn't use insulin well. This malfunction results in glucose staying in your bloodstream instead of fueling your cells. Over time, having too much glucose in your blood can cause serious health problems. It's like having a locked fuel tank in your car with all the gas just sloshing around uselessly. Not a good situation, right? Now you might be wondering, why does this happen? Why does the pancreas stop doing its job? Or why do the body's cells start ignoring insulin? Well, there could be several reasons, from genetic factors to lifestyle choices, and sometimes it's a combination of both. But we'll get into those details later. Just remember, diabetes isn't a one-size-fits-all kind of disease. It comes in different types, each with its own causes and characteristics. And like any other health condition, the sooner you identify and address it, the better you can manage it. So, now that we have a basic understanding of what diabetes is, let's delve a bit deeper into its types. Diabetes isn't a one-size-fits-all condition. There are different types, each with its own causes and symptoms. First, let's discuss type 1 diabetes. Previously known as juvenile diabetes, type 1 is typically diagnosed in children and young adults. It's characterized by the body's inability to produce insulin, a hormone that allows cells to turn sugar into energy. The exact cause is unknown, but it's generally thought to be an autoimmune reaction where the body attacks its own insulin-producing cells. People with type 1 diabetes are dependent on insulin injections or pumps to survive. Next, we have type 2 diabetes, the most common form of the disease. It's usually diagnosed in adults, but we're seeing it more frequently in children and young adults due to rising obesity rates. In type 2, the body either resists the effects of insulin or doesn't produce enough insulin to maintain a normal glucose level. The primary causes of type 2 diabetes are often linked to lifestyle factors such as lack of physical activity, unhealthy diet, and excess weight. Lastly, there's gestational diabetes, which occurs during pregnancy. Hormones produced by the placenta make the mother's cells more resistant to insulin. Most of the time, the pancreas can make up for this by producing more insulin. However, in some cases it can't keep up, leading to gestational diabetes. While it typically resolves after childbirth, women who've had gestational diabetes are at a higher risk of developing type 2 diabetes later in life. In terms of symptoms, all types of diabetes can lead to excessive thirst and urination, fatigue, blurred vision, and slow-healing wounds. However, each type may also present unique symptoms, which we'll delve into in the next segment. Understanding the types of diabetes is the first step in recognizing and managing this condition. Now let's look at the symptoms in more detail. What are the signs to look out for that might suggest you or a loved one has diabetes? Let's dive into this critical topic. A variety of symptoms can hint at the presence of diabetes, and they're often subtle enough to be overlooked. One of the most common signs is frequent urination. This happens because your body tries to get rid of the excess sugar by flushing it out through urine. If you find yourself visiting the bathroom more often than usual, especially at night, it could be a sign of diabetes. Now, let's talk about unexplained weight loss. You might think losing weight without trying is a good thing, but when it's a symptom of diabetes, it's not. In individuals with diabetes, the body cannot properly use glucose for energy, so it starts burning fat and muscle for energy instead. This can lead to noticeable weight loss. Another telltale sign is excessive thirst or hunger. High blood sugar levels can cause you to lose fluids quickly, leading to dehydration. This can make you feel thirsty all the time. Similarly, because your body isn't effectively getting the energy it needs from food, you may feel hungry constantly, even if you're eating as much as you usually do. Fatigue is another common symptom. When your body can't convert sugar into energy, it can leave you feeling tired and worn out. Other symptoms can include blurred vision, slow-healing sores, and frequent infections. It's crucial to remember that these symptoms can be vague and easy to miss. They might not seem serious at first, and you might attribute them to other causes like stress or aging. But if you or someone you know is experiencing several of these symptoms, it's worth discussing with a healthcare provider. Early detection is key in managing diabetes. If you catch it early, you can prevent or delay complications, such as heart disease, stroke, kidney disease, and vision loss. Recognizing these symptoms early can help in managing diabetes effectively. But how is diabetes treated? Stay tuned, and we'll delve into the treatment options in our next segment. Although diabetes is a chronic condition, it's manageable with the right treatment plan. Just as there are different types of diabetes, there are also various treatments available. The key is finding the right one that works best for you. Let's take a closer look at these treatments and how they can help manage diabetes. For type 1 diabetes, the body does not produce insulin, a hormone that helps regulate blood glucose. As a result, people with this type need to take insulin daily. This can be done through injections or an insulin pump. Insulin therapy varies for each individual. It's essential to work with your healthcare provider to determine the right amount and type of insulin for you. Type 2 diabetes, on the other hand, often starts with resistance to insulin. In this case, the body still makes insulin, but it's not used effectively. This type of diabetes can sometimes be managed with lifestyle changes alone, such as a healthy diet and regular exercise. However, many people with type 2 diabetes also need medication to help control blood sugar levels. There are several types of medication available, and your healthcare provider will help you choose the most suitable one. In addition to medication, some people with type 2 diabetes may also need insulin therapy, especially if their blood sugar levels are not adequately controlled with medication alone. Again, the type and amount of insulin will be individualized. Gestational diabetes, which affects some women during pregnancy, is usually managed with diet and exercise. However, some women may need medication or insulin therapy if blood sugar levels remain too high. Regardless of the type of diabetes, lifestyle changes are a fundamental part of treatment. A healthy diet that's low in sugar and saturated fats, combined with regular physical activity, can go a long way in managing diabetes. It's also crucial to monitor your blood sugar levels regularly and keep up with your medical appointments. Regular checkups are a must for anyone with diabetes. These appointments allow your healthcare provider to monitor your condition and adjust your treatment plan if necessary. They also provide an opportunity for you to ask questions and address any concerns you may have. It's worth noting that treatment for diabetes is not a one-size-fits-all solution. It's often a complex process that requires a personalized approach. Your healthcare provider will work closely with you to develop a treatment plan that fits your lifestyle and meets your health needs. Remember, the goal of treatment is to keep blood sugar levels as normal as possible and prevent complications. With the right treatment plan, diabetes is a condition that can be managed effectively, allowing you to lead a healthy, fulfilling life. So let's recap what we've learned about diabetes. We started on this journey by introducing diabetes, that pervasive health condition that affects millions of people around the globe. We delved into what it really is, a chronic disease that occurs when the pancreas is no longer able to make insulin, or when the body cannot make good use of the insulin it produces. This leads to elevated glucose levels in the blood and can cause long-term damage to the body's systems, especially the nerves and blood vessels. We then went on to discuss the different types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes, often diagnosed in children and young adults, is where the body does not produce insulin. Type 2 diabetes, the most common form, is where the body doesn't use insulin properly. And gestational diabetes, which occurs in pregnant women, usually resolves after delivery but increases the risk for type 2 diabetes later in life. Symptoms were next on the agenda. We highlighted how it's crucial to recognize the signs early for effective management. These can include frequent urination, increased thirst, unexplained weight loss, fatigue, blurred vision, slow healing wounds, and frequent infections. Remember, early detection is key. And finally, we explored the treatments available for managing diabetes. They range from lifestyle changes, like maintaining a healthy diet, regular physical activity, and maintaining a normal body weight, to medication and insulin therapy. It's crucial to understand that while diabetes is a lifelong condition, it can be managed effectively with the right treatment plan. But it's not just about understanding the disease, it's about taking action. Regular checkups and blood tests are essential to monitor your blood glucose levels. It's also important to take the prescribed medication consistently, and to follow a healthy lifestyle. Remember, every step you take towards managing your diabetes is a step towards a healthier, happier life. Diabetes might be a lifelong journey, but it's one that can be navigated with knowledge, understanding, and the right approach. It's about taking control of your health, knowing what to do, and doing it consistently. In the end, it all boils down to this: health is wealth. When we have our health, we have everything. So let's pledge to stay informed, to stay proactive, and to take care of ourselves and our loved ones. Remember, knowledge is the first step towards a healthier life. Stay informed, stay healthy,